Hi, welcome to yet another episode of the Joan's Wellness Hub. And in this series, we are talking about acne. And when we introduced the topic, we're saying that one of the ways or one of the etiologies or the causes of acne is hormonal changes or hormonal issues. And we have one condition in women that primarily affect women that we call polycystic ovarian syndrome that mainly manifests as acne. So you may be actually trying to treat your acne by using all the products and all the drugs, while the primary issue is actually polycystic ovarian syndrome. It means that if you do not address the root cause of this acne, then you're really not doing much when you're trying to manage what you're having. So I want us to talk about polycystic ovarian syndrome, but even before we do that, I would like to talk about the menstrual cycle, because one of the ways through which PCOS manifests is alteration of the menstrual cycle. So the menstrual cycle is regulated by what we call the hypothalamic pituitary ovarian axis. In our brains, we have a gland that we call hypothalamus. And then we also have the pituitary gland that is divided into two. We have the anterior and the posterior pituitary gland. And then in this case of menstrual cycle, we have the ovaries, okay? So we have three main phases of the menstrual cycle. We have the follicular phase between day 1 to day 14. Then we have ovulation, which takes place in day 14, and then the luteal phase, which takes place between day 15 to day 28, okay? So in the first phase, the follicular phase, we have a hormone that we call gonadotropin releasing hormone that is produced by the hypothalamus. So this releasing hormone stimulates the anterior pituitary gland to secrete what we call the follicle stimulating hormone. And in the follicular phase, the follicle stimulating hormone causes the growth of follicles in the ovaries, okay? So it is only one follicle, because quite a number of follicles are formed, but it is only one follicle that predominates. So this dominant follicle releases what we call estrogen. And this estrogen has three main functions. One of them is endometrial proliferation, and the endometrium is the inner lining of the uterus, and this is mainly where implantation takes place. So after fertilization has occurred and now you're pregnant, the embryo attaches itself on the endometrium. So estrogen causes endometrial proliferation. Number two, it causes what we call the negative feedback mechanism with the pituitary gland. So this is to prevent release of more follicle stimulating hormone, so as to prevent another dominant follicle from forming. And then number three, it has the positive effect or positive feedback mechanism. Estrogen causes a surge of luteinizing hormone. This luteinizing hormone is still produced by the anterior pituitary gland. So those are the three main functions of estrogen. And then we have the second phase where ovulation takes place. So we have said that the anterior pituitary gland also produces the luteinizing hormone, and this luteinizing hormone is what causes ovulation. So what happens, the dominant follicle that we said ruptures and releases the ovum, and then this ovum moves to the fallopian tube for fertilization to take place. Okay, and then so that is mainly the ovulatory phase. There is rupturing of the dominant follicle and release of the ovum, which moves to the fallopian tube for fertilization to take place. And then we have the luteal phase. In the luteal phase, so you have what we call the dominant follicle that has ruptured now forms what you call the corpus luteum. And the main function of this corpus luteum is to produce progesterone, because remember, the woman's body is preparing itself for implantation and the pregnancy in general. So the corpus luteum is what produces the hormone that we call progesterone, and the role of this progesterone is mainly to maintain the pregnancy. So it also prepares the endometrium for implantation, okay? And also this corpus luteum produces estrogen, just a small amount of estrogen. So as the cycle is towards the end of the cycle, if fertilization does not take place, the corpus luteum disintegrates, and there's definitely marked reduction in the levels of progesterone and estrogen, and so this causes the shedding of the corpus luteum and the endometrium, and this is what mainly comes out as the menses. Okay, so this corpus luteum disintegrates because towards the end of the cycle there's a marked reduction in the amount of luteinizing hormone, because in the early phases of the luteal phase, the corpus luteum is maintained by the luteinizing hormone. And then if fertilization occurs, the embryo produces what we call the human chorionic gonadotropin hormone that mainly maintains the corpus luteum, because in the early phases of pregnancy, the pregnancy or the corpus or the corpus luteum is what mainly secretes the progesterone before the placenta forms. So the human chorionic gonadotropin hormone, the HCG, is what mainly supports the corpus luteum. But now, because fertilization has not taken place, and also there's reduction in the levels of luteinizing hormone, then what is going to happen? Disintegration of the corpus luteum, reduction in the amount or the levels of progesterone and estrogen, disintegration of the endometrium, and that comes out as the menses. Okay, so in patients who have polycystic ovarian syndrome, this cycle is dysregulated in a way that you find that ovulation is not going to take place, and this is what causes an irregular cycle, so that you find you even stay for 3 months without having your menses, or even more, because ovulation is impaired. So we will look at what PCOS actually is and how it affects women and how it causes acne. So let me hear your input about the same, so that we continue learning. And let me also hear from you in the comment section what you want us to discuss next. Thank you, and keep up and keep following, keep tuning in our episodes as we continue learning. Thank you so much.